Okay. Good morning, everyone, and welcome to this We Have a Wednesday webinar. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be the moderator for today's webinar. Today's topic is Momentum Center, a collaborative community space for improving mental health. If you could go to the next slide for me, Barbara. As a reminder, all participants on this webinar are in listen-only mode and cannot unmute yourselves. If you have questions as the webinar proceeds, please post those in the chat box or the Q&A, and we will address them at the end of the webinar. Another reminder that this webinar is being recorded, and the presentation recording and materials from today will be available on our website, which I will put in the chat, and on the Illinois WorkNet website within 48 hours. The slide deck from today is available right now live during the presentation, and I will put that link to the slide deck and all of the resources that our presenter has provided for us today in the chat momentarily. And then in an effort to be as accessible as possible, this webinar will be offering closed captioning. And it is also offered on the recording as well. And then at the end of the webinar today and tomorrow, each attendee will receive a follow-up email, which will include a survey asking you about today's webinar. So that survey will actually pop up after the webinar in your browser. I will also put the link to it in the chat towards the end of the session. And then a follow-up email will be sent to you tomorrow with the same survey link, as well as the link to the recording and resources from today. So you will have access to everything from today. But please provide us with any feedback and suggestions you have to help us improve upcoming We Have a Wednesday webinars or feedback on this session in that survey. We would greatly appreciate it. And then just another quick reminder, if you have faulty internet connection or you're experiencing audio connection today, please feel free to call in, and you can do so by using the phone number in your original registration email that was sent to you from Zoom webinar. And with that, I'm going to start us off with our beginning We Have a Wednesday webinar polls that we do every We Have a Wednesday. So Barbara, if you could go to the next slide for me. So the first one is just, where's your local area? If you join us on Wednesdays, you are familiar with these polls. I know they can get a little redundant, but we do appreciate your participation in them as we use them for analytical purposes. So we'll give everyone just about 30 seconds to answer this. Just, where's your local area today? I'm joining you from Decatur, Illinois, which is in central Illinois. Our office is in Normal or Bloomington Normal area, but we are still working from home. So I see someone else is from central Illinois. So welcome to all my fellow central Illinoisans. And then Barbara, where are you joining us from today? I know you're from out of state, right?
Yes, I'm joining you from Grand Haven, Michigan.
All right.
On the water.
Oh, beautiful.
The other side of the lake.
Very jealous. So I'm going to end the poll and then share the results here so we can kind of debrief. But it looks like we have, most of us are from Northern or Central Illinois and one person from Southern. So welcome, everyone. And then Barbara, if you could go to the next slide. Our next poll is just, which partner do you best represent this morning? So Title I, Title II, 3, or 4, or if you best represent another WIOA partner or stakeholder, or our state or local workforce innovation boards. So we'll give everyone about 30 seconds to answer this poll as well. Okay, I'm going to end that poll and then share the results. Looks like most of us are joining from Title I this morning and a couple from Title III and other WIOA partners and stakeholders. So welcome, everyone. Thank you for spending your morning with us on this Wednesday. I know there is a lot going out in the workforce today. There's a lot of meetings and conferences coming up this spring as everyone is kind of navigating this virtual world. So we appreciate your attendance to our session today. And this session, again, is being recorded. So if you feel like any of your coworkers or you want to rewatch it would benefit from this session, we would appreciate your sharing of this session. And we're going to feature this session in our WIOA marketing that goes out every Monday coming up here. So just with that, I'm going to hand it off to our presenter, Barbara, and she will take it away.
All right, thank you very much, Kirsten. I am Barbara Lee Van Horsen. I'm the experimenter at the Momentum Center, which is a grassroots movement to create a stigma-free community. I'm very honored to be invited to present to your association today. I want to thank you for taking the time. I know we're right after spring break. This can't be an easy week for you to pull away for a webinar, so I'm really grateful for your being here. To learn more about our unique model for addressing mental health needs. It is called the Momentum Center for Social Engagement, and it's working as a community-based program that decreases depression, anxiety, and loneliness in its members. The model itself is comprehensive, but I'm going to share each component of the model because I think they can be used in a variety of settings. So to that end, I have three kind of objectives for our time together today. First, to share our starting point and the tools and techniques we use to leverage community conversations into vehicles for change. Next, to explain the 5 key factors that are responsible for the impact of the Momentum Center. And finally, to address the question of sustainability. If there were other things that you were hoping I was going to share, please feel free to put those in the chat box and I will try to address them. I want to start by introducing you to my son, Alex. Alex was a junior in high school when he had his first break from reality. He was a senior when he had his second break. And when he was 19 years old, we went through a long 5-month journey in and out of the hospital and residential care until we finally found the right medication to stabilize his schizophrenia and to stabilize his life. But by the time that happened, he had lost all of his friends. Now, we know that the most important thing people need in order to regain or maintain their health is human connection. But if you're in a situation like Alex's, how do you even begin to do that? Our story is very personal, but it's definitely not unique. In fact, 1 in 4 Americans will experience a serious mental illness during their lifetime. The 2017 Behavioral Health Barometer for Illinois found that more than 3% of adults in Illinois live with a serious mental health condition, such as schizophrenia, bipolar disorder, or major depression. Over 8% of 18 to 25-year-olds have had serious thoughts of suicide, and more than 12% of 12 to 18-year-olds had experienced a major depressive order. And of course, all of those numbers were pre-COVID. As we know, COVID has made everything worse. Mental health crises are increasing. Substance abuse disorders and relapse are both on the rise. According to the latest Kaiser Family Fund poll during the pandemic, about 4 in 10 adults have reported symptoms of anxiety or depressive disorder, up from just 1 in 10 in 2019. 56% of young adults age 18 to 24 now report symptoms of anxiety or depressive disorder, and young adults are more likely to report substance abuse, up from 13% to 25%, and suicidal thoughts, up from 11% to 26%. And we all expect that things are going to continue to get worse as we experience the short and long-term effects of greater isolation, financial distress, and not to mention the effects of chronic anxiety and a time where there is just so little certainty about anything. Those of you who work with ACEs, adverse childhood experiences, will understand when I say that COVID is an adverse experience. Now, the good news is that 70 to 90% of people with mental illness issues get better with some kind of treatment. But in Illinois, 55% of people with mental illness never seek any treatment at all. And the biggest barrier to getting treatment is stigma. So I'd like to stop here and just ask a couple of polling questions. I'm wondering if you know somebody yourself, if you or somebody you know is living with mental illness. And also just wondering how COVID has affected your own mental health. So Kirsten, if you would put those polls up.
Yes. So the first poll, do you or a loved one live with mental illness? Please answer that. And I also wanted to put a plug in that this poll, this one specifically, is completely anonymous. So we
Yes.
are not taking any names or any of your information. This one is completely anonymous. So it just shows us how many of you answered yes or no.
Yeah, thank you for that clarification, Kirsten.
Of course, yes.
As much as we are working to defeat stigma, it's still alive and well.
Okay, so I'm going to end that poll and share the results.
So you can see that 75% of the people on the call today either are experiencing mental illness or have a loved one who does. And I would hazard to bet that the 25% who answered no just don't know yet. We all know somebody in our life who is struggling with mental illness. We just aren't always aware of that. The next question is just, how has COVID affected your own mental well-being? Have you found silver linings and are actually doing well? Normal amount of stress, but you'll be fine. Some days are bad, but overall I'm getting by, or I'm struggling. I'm looking for resources, or I'm okay, but there's somebody else I'm worried about. Just wanting to take a quick anonymous survey of the group.
Okay, and that didn't share the results.
I appreciate your answering that. So most of us are doing well, doing fine. Some have even found the silver linings. And the biggest concern are for those that we know. So thank you again, just for that quick snapshot, even in a small group, to see the effect of COVID and mental illness in our own circles. So that's where the Momentum Center comes in. The Momentum Center is a grassroots movement to create a stigma-free community. So how did we get here? We started with community conversations. We began by working to connect people who wanted to make a difference with opportunities to do that, while also looking for where there were gaps in services. And we prioritized the voices of the people on the ground, the grassroots. When we asked people living in the community about what we and the leaders of the community needed to be paying attention to, mental illness, mental health came up time and time again. So that led us to holding our first town hall meeting on mental illness. There was another motivation for starting these large-scale community conversations, and that was just wanting to normalize the conversation around mental illness itself, a major step in reducing stigma. So we assembled a panel of community leaders to listen to the people on the ground. We asked the audience to be the actual leaders of the conversation, and we asked them who needed to be at the table to talk about the ideas that surfaced. It was those suggestions that led to the formation of the Mental Illness Task Force that would tackle the gaps that were identified by the community. Our town hall model has been incredibly successful in our desire to have community conversations, not only about mental illness, but about social justice and human rights. And we've been very intentional about using this model to enter into conversations that are usually polarizing, the things that we most often find difficult to talk about, which are, of course, the things we most need to find ways to talk about. So we've pivoted to virtual versions of the town hall during COVID, and we're currently using that virtual adaptation to host our monthly community-wide meetings on race and racism. The key to this success is our format and our ground rules. Both are designed to create a safe space where people can become more comfortable as the event goes on. So I want to start by just sharing with you the ground rules we use. We never have any community conversation about any topic without covering the ground rules. It's really part of our very fabric of our gatherings. And I'll just run through each of them. We start with honesty, that we aren't here to debate who's right or wrong. We're here to really share our experiences, what we have found to be true, and to be willing to listen to the experiences of others. Equality, We do bring panelists that bring an expert knowledge to the conversation, but we're all equal and valuable contributors to that conversation. Respect, all of us have preconceived ideas and they can get in the way of our listening to each other. So we want to be aware of that so we can remain respectful of ourselves and others at all times. We challenge people to active listen. It's really hard to be active listeners in this day and age, and it can be particularly challenging in a virtual format where we're taking care of kids and pets and food. So we really want to challenge everybody to try to be present and to listen to what's being said instead of thinking about what they want to say. A responsibility. We all have hot buttons and those can get triggered unintentionally. So if it happens, we want to be able to name it and own what we say as well as what we feel, to name those hot buttons instead of blaming somebody else for them. And finally, we work to create a shame-free zone, to really create that place where people are safe sharing what they really think and believe and have been carrying with them, because shame never solves anything. If anything, it shoves unhealthy thoughts and behaviors further underground where they continue to fester. So we work hard to create that place where we can accept people where they are and try to explore the things that are shared so that people can decide, look at them objectively and decide whether they want to continue to carry them with them or not. And after reviewing the ground rules, I always make a double ask. I'll ask if everybody's okay with the ground rules, and then I'll ask if there's anybody who's going to have a hard time with the ground rules. If we're in a virtual environment, I will suggest that if anybody doesn't think they can follow those ground rules, it would be a really good time for them to back out of the conversation, to remove themselves from the conversation. When everyone agrees to the ground rules, then the conversation can begin. The format is just as important as the ground rules. So we start with introductions. We open with the usual thank yous to our sponsors, our volunteers, our speakers, our guests, and then we go to explain the agenda so people know exactly what's going to happen that evening. The more information you can give people, the lower the level of anxiety in the room and the more ability you have to enter into genuine conversation. Then the meeting begins in earnest. We have the panelists each speak a short time, usually about 10 minutes. When we meet in person, you can sometimes have people speak for a longer period of time, and you can sometimes have more speakers. With the virtual format, timing is so critical that we've restricted ourselves to only 2 or 3 panelists, and 10 minutes is usually what they have. Occasionally 12 or 13 minutes if we only have 2 speakers. The presentations are meant to lay the groundwork for the conversation and not to be the star of the show. You don't come to the town hall just to listen to people, learn something and go. You really are there for conversation. So after the panelists present, we go into Q&A from the audience. And so for that reason, you also want to think through who your panelists are going to be, because you want them to be the people who can answer the tough questions that people in the community will have brought with them. They're there to inform, but their even larger role is to learn, to listen to the community and not to monopolize the conversation. And the next step is really the heart of the meeting. It's when the audience is invited to engage in small group conversation and the panelists each join one of the small groups. When we're meeting in person, that's done around a round table. In the virtual world, we do that in breakout rooms. And we have the questions preset, and they're meant to move people from anxiety to more and more comfort. So we'll start just asking what you've learned or why you're here tonight. We'll ask questions specific to the topic. And then the big question comes at the end, which is what can we do as individuals and as a community to address whatever issue we're talking about. Small groups have a time to process that, to come up with ideas, and then they report out. All their possible action steps are recorded. I like to ask people if, especially when we're in person, if there's anybody who hasn't figured out something they can do. We want to make sure that everybody leaves with an idea of an action that they can take. When we meet virtually, we have trained facilitators in the group that do the reporting out and who take notes of all the suggestions so that they can be forwarded to people afterward. The meeting concludes with that challenge for everybody to do something about what we've been talking about. And it's important we reiterate the idea that it's not our goal to solve the whole problem, but to just identify one thing we can do and then do it. When we get too focused on the big problem, it quickly becomes overwhelming and people feel defeated before they begin. So we just want to help people figure out one thing they can do and challenge them to do it. All of those suggestions are brought back to our task force, and they use the feedback to inform their next steps. From our initial meeting, initial town hall meetings on mental illness came the ideas that became the foundation for the Momentum Center for Social Engagement. But before I tell you about the Momentum Center, I want to pause for a second set of polling questions. So Kirsten, if you can help with that. The first question is just how comfortable are you talking about your own mental health and mental illness on a scale of 1 to 10? How comfortable are you just having that conversation? And what would make you more comfortable talking about it? And that would be a question that you could answer in the chat box. What would increase your level of comfort talking about mental health and mental illness? So it looks like the majority of people on this conversation are at about a 6. But we have people who don't talk about this. We have some 7 and 8s. And when we talk about mental health and mental illness, it doesn't need to be about particular struggles. It can be things like, I take yoga or I go on long walks just to keep myself in a healthy mental space. We really are working hard again to normalize that conversation. And so the second question, if you would throw in the chat box, would be what would make you more comfortable talking about mental health and mental illness? Is there something that would nudge that needle toward normalizing the conversation? Is it knowing that other people are also struggling? Is it having a set of ground rules that make it a safe place? Is there anything that would move that needle 1 notch to make you more comfortable talking about mental health and mental illness?
So if you could go ahead and post your answers in the chat, we will debrief on them. Give everyone a couple seconds to type.
I originally had a polling question with options and then thought, well, maybe an open-ended question would be more helpful. But again, I think as we reflect on the fact that this topic is still highly stigmatized, it can be a real challenge for us to find those places where we're comfortable talking about mental health at all.
Yeah. Barbara Kelly said more knowledge about mental health. I think knowledge is power, so I would agree with that. For my own mental health, I will be vulnerable and share with the group today. I think just knowing what other people are going to, and if you can relate to it, always helps anyone feel more comfortable when they're being vulnerable or diverging something about themselves. Carmen says guaranteed support would help them feel more comfortable.
Yeah, it takes real courage to be transparent and talk, because you don't necessarily know how accepting. There's so many stereotypes. One of my personal frustrations, my son, as you know, has schizophrenia, because I shared that at the beginning, and it's an interesting phenomenon. I also have a stepdaughter with Down syndrome. And if I talk about my daughter with Down syndrome, people will lean in and say, oh, she must be just a lovely person, which she is. And then I'll mention my son has schizophrenia, and you'll see people literally physically withdraw and become afraid of somebody who there's no reason to fear at all. And so I think absolutely creating that knowledge, helping people understand, for instance, that violence is not even a symptom of schizophrenia, despite what we might think because of the way news stories are so often portrayed. So that educational piece, and then being there to support and not to judge. So I thank you, Kelly and Cameron, Carmen, and also thank you for sharing, Kirsten. Appreciate that feedback. If you have other thoughts as we go, feel free to enter them. So I want to talk about the Momentum Center for Social Engagement, because that is our goal, to decrease, to eliminate stigma, to be that safe space. As I said, it was those community conversations that led to the founding of the Momentum Center. It's a social and recreational program for people with mental illness, addictions, and disabilities. We act as a complement to clinical and therapeutic care, but instead of just telling you about it, I'd like to show you our sizzle reel. I'll take you inside. The Momentum Center is a grassroots movement to create a stigma-free community. We offer opportunities to nurture, educate, and inspire individuals, so together we can address issues of social justice and human rights in our community. Located at 714 Columbus, the Momentum Center for Social Engagement offers recreational and virtual opportunities for adults with mental illness, addictions, and disabilities. People just like me and just like you. Momentum Center teams offer social and recreational opportunities for young people, beginning at 11 years old.
It is like a hope. It is kind of like a beacon. You know, it is a place that we congregate, that we gather.
When you're not having a good day, there's someone there that you can talk to and socialize with.
They go out their way to take us on field trips, and they don't charge us anything.
I've really got to know a lot of my friends through the momentum that I wouldn't have if I never started this journey.
No diagnosis or referral is needed, and membership in either program is just $1 a year. The Momentum Center moves people out of isolation and into a community that is safe, welcoming, and working day by day to dismantle stereotypes and end stigma. Just Goods Cafe is located within the Momentum Center. It is a member-run opportunity to enjoy a beverage with a local baked good. Stop in to get to know us in the comfort of a stigma-free community. And visit Just Goods Gift Shop in the Depot on the Grand Haven waterfront. The Momentum Center facilitates community conversations, including Inspire events and town hall meetings on mental illness. Together with the Anti-Racism Task Force, we have also launched a series of town hall meetings on race and racism. Everyone is invited to join these collaborative community conversations. The Momentum Center leads cultural immersion experiences around the world. Cultural immersion is not a vacation or a mission trip, but an opportunity to learn about people, customs, and community. Cultural immersion experiences are both international and local, including opportunities to address the cultural divide just across the bridge. Contact us to reserve your place on a life-changing cultural immersion experience.
So you must sign up and come next year with us. Thank you.
The Momentum Center embraces the idea of mudita, a Sanskrit word that means I rejoice in your good fortune. We celebrate the good fortune of people who were once isolated and have now found community. And we invite you to celebrate with us. Donate, attend, volunteer, participate in our annual events, including the Salmon Run to erase stigma and Prom with a Purpose. Have a wonderful experience while you help create a stigma-free community. The Momentum Center is a community response to a community issue. We need you to be part of this community solution. So the Momentum Center fills an important gap in the continuum of care between the person and clinical care in both directions, because anyone can come at any time. We're a place for early intervention. And again, we emphasize the fact that you don't need a clinical diagnosis, you don't need a referral. All of us struggle with something at some point, situational anxiety, feeling down about COVID. We really do try to dismantle the idea that there's us and them. We're all in this together. Me and most of my staff are members of the Momentum Center. We do sometimes have people come and volunteer. And then after a couple of months, once they recognize it's a safe place, they say, you know, I really should be a member. And again, become transparent and vulnerable about their own struggles. We regularly refer people to community mental health and other mental health providers. But the exchange goes the other way too. We're also a place where people can go to get their behavioral needs met. Tracy, for instance, saw her therapist once a month, and Tracy was always given the same instructions. Take your medication every day, eat right, get some exercise, and socialize with other people, and come back next month. But Tracy's depression just grew more severe over time because she rarely did any of the things that she'd been instructed to do. She didn't know how to fill a behavioral script. But when she found the Momentum Center, she signed up for yoga. She took a class in nutritious cooking. She found a community of care that was friendly and welcoming. And because she found community, she started paying attention to taking her meds daily, just as prescribed. Which all leads to the important question of impact. What difference are we making? It turns out that the impact is significant. We are normalizing the conversation. We've created an empathy-first community that's giving purpose, hope, and meaning to members. And in some cases, like Rebecca's note here, we are literally saving lives, as she writes about finding a place where someone cared, whether her choice was death or life. Our research backs it up. We knew that we were using a model that was unique. Nobody else is doing what we're doing. And we knew if it worked, we'd want to share it with people like those of you in Illinois. And to do that, we needed more than our anecdotal feel-good stories. We needed to talk about more than Alex and Rebecca and Tammy and Tracy. We needed to have the data to back it up. So we put data collection tools in place at the very beginning. We collect data at intake and at 6-month intervals thereafter. And our members with moderate to severe depression are reporting a 33% reduction in their mean PHQ-9 metric after 1 year. Members with moderate to severe anxiety reported a 71% reduction in their mean GAD-2 score after 1 year. Members reported significantly reduced symptoms associated with moderate to severe loneliness after a year, equating to a 20% reduction in their mean loneliness score. And they're also showing a statistically significant increase in their level of social connectedness. So to understand why it's working, we conducted qualitative research through observation, interviews, and focus groups. And we identified 5 key techniques behind our success. The first is management by strengths training, or MBS. It's required of all of our staff and all of our volunteers. Members are welcome to take the assessment and the training, but they're not required to do so because of the vocabulary necessary. And we don't want to create a different tiers of membership. The MBS survey is quick, non-threatening tool to reflect a person's basic communication style and a general description of their strengths. Each temperament is assigned a color. Directness is red, extroversion is green, pace is blue, structure is yellow. And then MBS training occurs once a month. People can repeat that class as often as they want. And we have that grid on our name badges. And we all wear our name badges, whether we're staff or volunteers, whenever we're on site. The purpose of MBS is to provide that empathy-minded communication, teaching volunteers and staff how best to communicate with others, understanding how a person communicates, makes decisions, and how they want to be treated is a first step in establishing or improving any relationship. So MBS training allows for a rapid assessment of a person's strengths and communication preferences. It only focuses on strengths. It does not talk about weaknesses at all. And the graph, as I said, is displayed on our name tag. So it's visible and it enforces that empathy-based communication, both consciously and subconsciously. And what we found is that this training is ideal for this Momentum Center because members who've never learned empathy-based communication skills experience a trickle-down effect. The members learn through observing trained volunteers the appropriate communication approaches that they can use with others. So essentially, volunteers set the precedent for the behavior within the center for both new and existing members. And the members interviewed talked about one of the major skills that they've learned at the Momentum Center is empathy. So building empathy skills begins with staff, it's reinforced with volunteers, and it trickles down to the members to truly imbue the center's community with other-mindedness and a focus on strengths. The cost of joining the Momentum Center is $1 for the entire year. That dollar fee allows us to track membership and participation rates. Some of the activities that we provide are yoga, exercise, meditation. We have baking classes and cooking classes, bingo. We've had people teach Spanish and German, financial literacy, you name it. At some point, we have done it or we definitely will do it. But that dollar covers everything, including our outings. At least once a week, we go someplace locally, might be grocery shopping, bowling, to the park, to a carnival, anywhere. And at least once a month, we go further away to a zoo or a farm or a sporting event. The dollar membership fee has become a ritual act. When somebody enters a new community, they are typically seen as an outsider. And the first step to becoming an insider is to perform some kind of ritual act. So a transitory ritual act is a shared social investment, marking that transition from outsider to insider. And the transitory act for becoming a member is represented here with a monetary investment. It's a symbolic investment of offering the dollar that creates inclusion. The dollar is a relatively low cost, so it recognizes that anything more than that can be a real challenge to disadvantaged individuals. And while we have had memberships paid for by other people when finances truly are a barrier, that dollar investment can be made by almost everyone. So it removes any notion of classism within the center, the community in the center. Another important aspect that makes the Momentum Center successful is its unique atmosphere and its aesthetics and use of color. So when you walk into the Momentum Center, members and patrons are greeted with very pleasing imagery. Arts and crafts are prominently displayed throughout the cafe, and there's a color scheme that's soft and inviting. The cafe is an important part of the Momentum Center because that's open to the community. And I'll return to talk about that a little bit more. Music is streamed in from iHeartRadio, which makes things more lively. And it seems like a small thing, but if the Momentum Center were more sterile, it would stifle the communication between members. To disadvantaged communities, white sterile walls can elicit negative reactions. Stark colors, limited decoration can increase anxiety and stress. So we choose brightness, open windows, art, music. In the back room, we have these soft green walls, which create more of an active social space instead of an exciting red or yellow. The walls aren't overstimulating, just lively. And the music is played quietly to supplement the room's atmosphere. Natural light works alongside the color and the aesthetics to give that calming atmosphere. And then, as I mentioned, the cafe is run by members and open to the public. That's where many of the crafts are displayed, and it's an important piece of that community integration. That place where, again, we break down the barriers, we confront stereotypes, and we work to defeat stigma. Destigmatizing and safety offer another crucial element at the Momentum Center. Eliminating stigma and developing an integrated community is one of our 4 cornerstone goals. Members often report feeling excluded from the wider community and often attribute that to stigma. So to put it simply, members are met where they are and accepted for who they are. Individuals connected to our members through family or therapeutic relationships often report that their loved one is more engaged in the outside community, having found a place of acceptance at the Momentum Center. Professionalism and the enforcement of very clear boundaries create a safe place. And that safety, coupled with empathy training, provides an environment where people are able to express themselves without worry of social stigma. And finally, one of the most important and unique aspects of the Momentum Center is the way we provide members a sense of personal agency. This is what most differentiates a Momentum Center from a clubhouse or a drop-in center. So unlike a drop-in center, the Momentum Center is program-based. You can't show up and sleep on a couch all day. And unlike a clubhouse, there's no set schedule that you have to adhere to. There are basic rules of conduct that members have to follow. But beyond that, members aren't required to do very much while they're inside the Momentum Center. Instead of those kind of obligations, they're given options. All activities are presented as a choice, and opting out of certain activities brings no social shame. A constant independent decision-making is empowering, and that positive approach assists members in feeling comfortable when they're within the building. So taken together, these 5 techniques intertwine to create a calm, inclusive, and empathy-focused environment. The dollar investment is a symbolic investment that creates a sense of community and familiarity upon becoming a member. The MBS training is a passive method of teaching effective communication skills without presenting them as obtrusive. The room size, aesthetics, and music invoke a safe space. Safety and trust in staff creates an environment where one can be vulnerable and open and assist with bonding and communication. And lastly, personal agency allows members to choose why they come to the Momentum Center to begin with and what they would enjoy participating in, from what activities they'd like to opt out. And all of these aspects are innovative and that they're inexpensive to implement, they're unique, and they've proven themselves to be quite powerful. So with that, that's a thumbnail of everything we're doing. And I want to ask you, why do you think the Momentum Center works? And do you think that this model would work in your community? So having heard what we're doing, what aspects stand out to you? If you could just note in the chat box that would strike you as a reason that this is working, that we're decreasing depression, anxiety, loneliness. And do you think this is a model that would work in the community you serve?
So I'm going to put up the poll for the second question. So we'll give everyone about 30 seconds to answer that, and then also please answer in the chat. But I really think, Barbara, that the Momentum Center works because you're really providing a sense of community, but it's not forced. So they can participate however much their comfortability level allows them to. And they can start at a lower level of participation potentially. And then as they get more comfortable, as they meet more people, as they see others who participate more, it kind of gives that example for them. And it also not only provides a sense of community, but a sense of community for people to meet people that they can relate to, right? On that mental health they're already going to the Momentum Center knowing that other people there that they meet are struggling with maybe not the same, but similar mental health issues that they struggle with. And so they are already have that in common with them. They can relate to them and on that deeper level. Our attendees are saying, did you want to say something? Sorry, Barbara.
I was just going to say that I do think another one of the pieces that is very unique to the Momentum Center is we do bring populations together that normally are segregated. So we do bring together people with mental illness, people with addictions, and people with disabilities. And often those are separate communities. And I think bringing together that mix is, again, helpful in showing that, you know, all of us have some kind of barrier, and that we're all stronger in community. So yeah, I agree that that there is, you know, if you go there and know you're not alone, you're joining other people who share some kind of life experience or struggle with you.
Yeah, so we did have Tammy said that she thinks that it's working because of inclusion, it's customer driven, and it supports. And I couldn't agree more, Tammy. And then I did share the results from that polling question as well, Barbara.
Okay, thank you. I see, yeah, we had about 60% say you think it would work. A couple of people have no idea, and I'd love to engage in a follow-up conversation to explore that. Because again, we are finding it's working, and so we want to share that, you know, and if there's any parts of this, any of the variables that would be helpful, then I certainly want to help be a catalyst for bringing this model elsewhere. Let me move on to the last question, or the last, oops, hitting the wrong button. My last objective for today, which is to talk about sustainability. Much of what makes us innovative also gives us an edge on sustainability. So first of all, we are a very organic organization. We really didn't start out with a preconceived outcome in mind, which allowed us to really think out of the box from the beginning. We embrace the experimental aspect of what we're doing. I shared that that's my title is experimenter. It's all an experiment. When we do something that works, we celebrate and we do more of it. When we do something and it doesn't work the way we thought, we celebrate the attempt. We figure out what we can learn from that experience and we try again. We're flexible, adaptable, and agile, which gave us an edge when COVID hit. We were able to pivot to live streaming activities, setting up phone buddies for our members, delivering care kits, and generally helping people to continue knowing that they were part of a community, even when we couldn't be physically together. Second, we're relational and we're collaborative. Almost as soon as we were founded, we convened the Mental Illness Task Force, bringing the right people to the table to talk about how we could work together to create better outcomes. It was kind of a nonprofit version of a social lab. Our building also acts as a physical hub for other nonprofits to bring their materials. So people have a brick and mortar place that they can go to find resources in the community. And it's through those partnerships that we continue to identify innovative collaborations that provide opportunities for identifying and utilizing new sources of funding. And third, we knew from the beginning we had to be social entrepreneurs. Having experienced myself working with nonprofits that were not financially sustainable, we knew we needed to create our own income stream. So our ability to serve wouldn't be at the mercy always of other people's charitable impulses. So to that end, we operate the Momentum Cafe that I mentioned. We also own and operate Just Goods Gifts, which is a fair trade and social cause store located in a busy tourist area. So it's all traditional fair trade. And then we have partnerships with other organizations. For instance, for us, it's called the Young Adult Services, and those are the students with developmental disabilities that can stay in school, in our state anyway, until they're 26 years old. And so they make things that we sell, and then we're there when they age out of that program to be able to continue to be in community. We also have partnerships with Humanity for Prisoners, Prisoners make items that they give to Humanity for Prisoners, and we sell at the store. So we have social cause items. We really hope that Just Goods and the Momentum Cafe will provide that long-term goal of providing training and employment to members as well, who are not able to succeed in a competitive workforce. So we train our members to deliver customer service, but we also want to get to the point where we can hire people for $10 for 10 hours a week. Those small carve-out jobs that, again, are a more holistic approach to taking care of providing people with the resources that they need. And then another key to our long-term sustainability is to continue to provide evidence of our outcomes and our impact. We've added resiliency measures to our data collection. Anxiety, for instance, can be triggered by things totally outside of our control. COVID comes to mind. But if we're helping our members to build resiliency, they will be better equipped to deal with those challenges when and wherever they arise. So we believe resiliency will be a more reliable measure of our effectiveness over time. And we're embarking on research with our partners, including Michigan State University, Community Mental Health, North Ottawa Community Health System, and Pine Rest, to do comparative analysis to even more clearly demonstrate the efficacy of the momentum-centered model. And finally, we want to share this model, as I've said, with others. We've created documents that define the requirements to open a Momentum affiliate, and we believe that this model fills that space in the continuum of care in any community. We have the instrument ready to ensure integrity to this particular model. We're also in conversation with our geographical neighbors in Holland and Muskegon about how best to bring and expand our work to meet their population needs. And we would welcome conversations with any of you on how we might work together to establish Momentum Centers in Illinois, or how our journey might inform your own journey. So I do believe that I've covered all of our objectives today. We talked about the format, the ground rules for constructive community conversation. We've covered the key elements that explain why the Momentum Center works, and we've reviewed next steps for sustainability. So I want to kind of wrap up this portion by returning to Alex and how he's doing today. So today, Alex is 26 years old, and he has found friendship and community at the Momentum Center. The skills and the confidence that he's built there have helped him to achieve a level of independence that once appeared really impossible. He now lives with a roommate within walking distance of the Momentum Center and a block away from the restaurant where he cleans 10 hours a week. He and his roommate have become avid fishermen, and he regularly explores town on his bike and on his moped. He's really looking forward to the lifting of restrictions so that he can once again grill the hot dogs and the hamburgers that we would serve at our monthly community dinner and movie nights. We're really anxious to be able to resume those. And giving, that's his way. His grilling is his way of feeling accomplishment and purpose and meaning by giving back to the community that helped him to integrate into the much larger community in which he lives. So I'm thrilled to share that success story. And I'm happy to answer any questions that anyone might have. Also, my email is on the screen, so I'm happy to have a follow-up conversation with anybody, particularly if you have questions or suggestions that we should take into consideration as we work to, again, create a stigma-free community. So I would like to pause and just see if there are questions for me.
Great. Thank you, Barbara. Thank you so much for taking the time to present this morning. There are no questions in the chat as of right now, but we'll give everyone a minute or two to ask any if they want. And as I do my housekeeping here at the end. So I am putting a link for the follow-up survey in the chat. If you have a couple minutes, we would greatly appreciate that feedback. It should pop up as soon as we close out of the webinar as well into your browser. And then that same link will be in the follow-up email that you will receive tomorrow as well. That same follow-up email will have the link to all of the presentation slides, resources, and the recording from today. Please just allow 48 hours for the recording to go up. So that way we have time to close caption it and allow myself time to get the recording up, really is what I'm doing. And then I guess that's it. Yes, this is recorded and then the follow-up email. So we covered both of those. I don't see any questions coming in, Barbara, but thank you again so much for your time this morning. Thank you to all of our attendees. And please share this session's recording with anyone that you feel might benefit from it. We would love to get more information about the Momentum Center out to the system. All right, any final thoughts, Barbara?
Just again, my thanks and appreciation. Again, I know this is a really difficult week, and so thank you so much for taking the time. I normally end by saying that the divine in me recognizes and bows to the divine in you. Thank you and namaste.
Namaste, Barbara. Thank you, everyone. Have a great rest of your Wednesday.